And joining us now to discuss the second wave of the COVID-19 pandemic in the world is a public health expert, Tuyi Mebawandu. Good to have you join us, Dr. Mebawandu.
Thank you.
The figures are alarming when you look at figures we're hearing from around the world, whether in the United States or the United Kingdom. But globally, we now have over 91 million cases. We've seen about more than 50 million recoveries, and then about 1.9 million deaths. When you look at these figures amid the vaccine, are we anywhere close to curbing the spread of this virus?
Sincerely, we're not close. Let's not give ourselves false hopes. Here's why. Number one, even if you are going to use vaccines, yes, there's a challenge of production. Okay, Pfizer is having challenge. I mean, they can only deliver how many millions? About 100 million doses to the United States of America. That will be for 50 million people. That's 15% of the population. There's a delay in delivering to other countries. They've recently also approved the other vaccines, two other vaccines to be used. The AstraZeneca one to be used in UK. And there are a lot of issues whether you can combine the one of Pfizer with that of AstraZeneca. Now, even if you have vaccines, you can see that since then, they've only had up to 35% vaccination rate, even for that 50 million people. So there are a lot of issues. There are doubters, there are anti-vaxxers. There are a lot of religious opposition to the vaccines. The narration has been terrible and actually challenging. So we're facing that. And then we also face the challenge of even using the human resources to deliver those vaccines, because we all agree even here that, it's not just vaccine. What we want is vaccinations. Vaccine will not cure anybody. It's vaccinations. So to move from vaccine to vaccinations involves a lot of steps that must be tidied and must be thorough and must be effective. If we fail, because you can produce a product that is so effective, but it may not be efficient, that may be efficacious, but it may not be effective. Efficacy has to do with the laboratory, being effective has to do with the field, what you do on the field. So now you have to achieve as much as 70% vaccination to get your herd immunity. Where are you going to get that? How long will you now get that? So what is now left with us is to look at it that while we're waiting for that 70% herd immunity, what do we do? The only thing we'll do, the most effective prevention against COVID-19 is social distancing. That's the most effective prevention.
Before we get there, I want us to bring it to Nigeria, because first of all, we are expecting maybe about 20 million doses of the vaccine in the country. We're hearing about this month. But some health experts like yourself have said, look, we don't have the facilities to even store these vaccines in the first place, especially when you look at the Pfizer-BioNTech vaccine that has to be about minus 70 degrees. So where are we here? Because we're also hearing about hospitals not being able to accommodate the severe form of this virus, according to the NCDC. So where are we now?
Even as at December, mid-December, early December, the hospital system in Nigeria broke down. You see, because in public health, truth is so important. Lies will kill more people than the virus. So we must be able to be on the same page where the government tells us where we are exactly, so that we know what we need to do. So a lot of cover-up, a lot of half-truths, a lot of misinformation, disinformation is now compounding what we should know. The hospital has broken down. Let's not just deceive ourselves. Then when it comes to the vaccines, yes, I heard that somebody is sending 100,000 vaccines to us. 100,000 vaccines, that will only vaccinate 50,000 people, as it were, because there are 2 doses. Let's agree that all other criteria are fulfilled. We have help to do all those things. 50,000 people out of 200 million people, what would that reach? Then you now see the politics of distributing those vaccines. You see the inequality and iniquity of distributing those vaccines. The people that need the vaccines most will not get it. When I saw the distribution pattern, and I saw that they are allocating more of the vaccines to Kano State and about the same amount or less to Lagos. And when you look at the figures, Lagos is having like close to half of the cases of COVID in Nigeria. In reality, Lagos, FCT, and Kaduna also should have the priority distribution, because they are the ones showing the cases. If you deal with the challenges in Lagos, deal with the challenges in FCT, and that of this place, you know that you can then honestly break down the number of COVID in Nigeria.
I mean, very interesting conversation to have, but I'm afraid we do have to leave it there. Public health physician Tuyi Mbebawandu, thanks for talking to us and sharing all of this with us.
Thank you.